Hello, this short video looks at each of the 12 potentially modifiable risk factors for dementia and why it is important to try and reduce the risk. These 12 risk factors account for around 40% of worldwide dementias. The information in this video comes from the Lancet Commission report on dementia prevention, intervention and care, published in 2020. Less education in early years. Early life factors, such as less education, affect our reserve of thinking abilities. This is called the cognitive reserve. However, researchers think that mental activity helps to build your cognitive reserve. Regularly doing the things you enjoy, whether that's reading, crosswords, singing, doing puzzles, or playing an instrument, will help challenge your brain and keep you mentally active. Why reduce your risk? Because the Lancet Commission report stated that if we could eliminate lack of education in early years, we would see a 7% reduction in dementia cases globally. Hearing loss. Research has suggested that hearing aids may reduce this risk. It is therefore important to have your hearing checked regularly from midlife. The RNID provides a free hearing check online. Visit rnid.org.uk and search for free hearing check. Why reduce your risk? Because research has found a link between hearing loss in mid to late life and the risk of developing dementia. The Lancet Commission report stated that if we could eliminate hearing impairment, we would see an 8% reduction in dementia cases globally. Traumatic brain injury. Wearing protective headgear when playing sports, such as cycling, horse riding, and boxing, is a sensible thing to do. Some research has suggested that a serious head injury, trauma, or repeated concussion might increase the risk of developing dementia. Why reduce your risk? Because the Lancet Commission report stated that if we could eliminate traumatic head injury, we would see a 3% reduction in dementia cases globally. High blood pressure. Being physically active can help you reduce your risk of heart disease, including high blood pressure, which is a risk factor for dementia. If you find an activity you enjoy doing, you're more likely to exercise more often. Why reduce your risk? Because research has found that identifying and treating high blood pressure in midlife may reduce the risk of dementia. It is important to have your blood pressure checked every 5 years if you are over the age of 40. You can have your blood pressure checked at your doctor's surgery or at some pharmacies. The Lancet Commission report stated that if we could eliminate high blood pressure, we would see a 2% reduction in dementia cases globally. Alcohol consumption. The Chief Medical Officer's low-risk guidelines recommend both men and women should not regularly drink more than 14 units of alcohol a week. If you drink, try to spread out alcohol consumption over at least 3 days, with several drink-free days each week. Why reduce your risk? Because research has found a link between regularly drinking too much alcohol and an increased risk of dementia. The Lancet Commission report stated that if we could eliminate alcohol consumption, we would see a 1% reduction in dementia cases globally. Obesity. Being physically active can help you maintain a healthy weight, reducing your risk of obesity, which is a risk factor for dementia. You're more likely to exercise more often if you find activities you like doing. Keeping active with others can make it an enjoyable social occasion. The government's Eat Well guide shows what a balanced diet typically looks like and acts as a guide to healthy food choices. Why reduce your risk? Because the Lancet Commission report stated that if we could eliminate obesity, we would see a 1% reduction in dementia cases globally. Smoking. If you smoke, quitting is one of the most significant steps you can take in boosting your heart and brain health. Why reduce your risk? Because researchers have found that smoking increases your risk of developing diseases like Alzheimer's and vascular dementia. Whatever age you stop smoking, it helps improve your health, so it's never too late. The Lancet Commission report stated that if we could eliminate smoking, we would see a 5% reduction in dementia cases globally. Depression. Keeping socially active by spending time with other people can be a good way to feel happier and more positive in life and to look after our brain health. Why reduce your risk? Because depression is associated with incidence of dementia. If you need help, speak to your doctor or mental health professional or call Samaritan's helpline on 116-123 or email joe@samaritans.org. The response time for email is 24 hours. The Lancet Commission report stated that if we could eliminate depression, we would see a 4% reduction in dementia cases globally. Social isolation. Keeping socially active by spending time with other people can be a good way to feel happier and more positive in life. Social contact is crucial for our brain health. Why reduce your risk? Because research has linked social isolation and loneliness to a higher risk of dementia, although research is still ongoing to understand why this relationship exists. The Lancet Commission report stated that if we could eliminate social isolation, we would see a 4% reduction in dementia cases globally. Physical inactivity. Regular physical activity has many benefits, such as the prevention and management of many long-term conditions, including dementia. Being active doesn't have to involve going to the gym or running a marathon. Find an activity you like doing. Why reduce your risk? Because the Lancet Commission report stated that if we could eliminate physical inactivity, we would see a 2% reduction in dementia cases globally. Air pollution. Getting out into the countryside when you can will give you a boost of fresh air. Air pollution is not something we can really avoid, but we can make our voice heard at local and national government levels and demand cleaner air in our cities, towns and villages. Why reduce your risk? Because there is evidence that air pollution is associated with poor health outcomes, including dementia. The Lancet Commission report stated that if we could eliminate air pollution, we would see a 2% reduction in dementia cases globally. Diabetes. Regular physical activity has many benefits, including the prevention and management of many long-term conditions, such as dementia. Being physically active can help you reduce your risk of type 2 diabetes, which is a risk factor for dementia. You're more likely to exercise more often if you find activities you enjoy doing. There might be activities you can take part in with other people, like walking, dancing, or cycling. Why reduce your risk? Because the Lancet Commission report stated that if we could eliminate diabetes, we would see a 1% reduction in dementia cases globally. The 12 potentially modifiable risk factors can be divided into risk factors in early life, midlife, and later life. If we were to eliminate all of these 12 potentially modifiable risk factors, we would see a 40% reduction in dementia cases worldwide. This equates to 20 million people. If you have any concerns about your health or about dementia, please speak with your GP. Thank you for watching or listening to this video. The information and data in it is reproduced with kind permission from Alzheimer's Research UK from the Dementia Prevention, Intervention and Care Report of the Lancet Commission published in 2020. The full text of the report is available from www.thelancet.com.